Hi, my name's Allison LeBouef. I'm one of the clinical directors at Pediatric Therapy and Learning Center, and I'm also an occupational therapist. Today, we are going to be talking about why does my child do that, and focusing on the topic of why my child has frequent meltdowns and overreactions to different events. To be able to do that, we need to talk about the brain a little bit. Just for simplicity's sake, we're breaking the brain into two separate parts. The reactive part that helps us to respond to danger, and also the thinking part that helps our planning and our language skills. When we have emotions come into the brain, such as surprise and sadness, danger, anger, and fear, these go into the automatic reactive part. So they are allowing us to be ready for threat and danger. Unfortunately, when these come in, they knock off the thinking aspect and hijack that part of the brain, causing the body to just be more reactive than be able to plan. So what can you do to help your child when they're having these moments? We're going to try and get the child back on track into thinking mode. To be able to do that, we need to get down on the child's level, make eye contact, and make sure they understand we're present. We're trying to make ourselves smaller to decrease the threat and danger that being big presents to a child. We also need to lower the voice and decrease the amount of words that we're using. Remember, that thinking part of the brain is off track right now, so using too much language is only going to overstimulate the child, and if we're too loud, we can certainly increase the fight, flight, or fright that they're already in. In order to get the brain back on track, we want to try to use some of those language words to help the child identify some of the emotions they are having. So try and help label the child's emotions for them in order for them to start being a little reflective on that and get out of that reactive state. Emotions can be confusing, and children often lack the language labels for what they're feeling inside. So helping them do this will also help for future. Also, don't forget to practice patience, not just with your child, but also with yourself. It's really tricky to keep ourselves out of that fight, flight, or fright when our child is in the midst of a meltdown. So give yourself some grace, and if you don't get it right the first time, just keep on trying. If you need more information on how to help manage your child's meltdowns and temper tantrums, visit our website, www.pediatrictlc.com. We'll see you next time.